Okay, so today we're going to talk about primary hyperaldosteronism, or also known as Conn's syndrome. So presentations usually in young non-obese and non-black patients with hypertensions should raise suspicions for secondary hypertensions. Patients usually present with hypertensions, mild hypernatremia, hypokalemia, and metabolic alkalosis. So now we're going to go to the mechanisms. What's the mechanisms of Conn's syndromes? It is caused by aldosterone-producing adrenal tumors. So let's look at the adrenal glands right here. We will take a closer look at the adrenal gland later, but I just want to give an overview. Adrenal gland has it has the capsules right here. The capsule that goes around the adrenal gland, and it has the adrenal cortex. Adrenal cortex has 3 layers: GFR, glomerulosa fasciculata, and reticularis in the medulla, and each layers produce different hormones. And what we're gonna see right here, there's three different zones of the adrenal cortex. Each one has different functions. The first one we could say, so salt, sugar, and sex. The first one, glomerulosa, produce aldosterones that's involved with sodium reabsorptions. The second one involved with cortisol secretions, regulate metabolisms and stress response. And the reticularis is the one for androgen, so it's the sex hormones. And within years, the medulla mainly secretes catecholamines, which include norepinephrines and epinephrines. So let's go back here, the mechanisms of Conn's syndrome. So caused by aldosterone producing adrenal tumor. So the tumor is within the adrenal gland, and more specifically it's in the adrenal cortex. And the layers that's involved is the first layer, which is glomerulosa. The glomerulosa is the layers that involve in the secretions of aldosterones, and aldosterone causes increase in sodium reabsorption. So it makes sense to know that when there's an increase in the secretions of aldosterones, we have an increase in reabsorptions of sodium. So increase in reabsorption of sodium will cause an increase in the reabsorptions of water, because water mainly goes along with sodium. Wherever sodium goes, water will go with it. So an increase in water reabsorptions in our body will lead to a volume expansions, and that causes hypertensions. And how does increase in the aldosterone secretions affect renins? So let's check here renins. Why does renins decrease? Renins, the normal mechanisms of renin is to raise the blood pressure. When the body senses that there is a decrease in blood pressure or volumes, the body will secrete renins. So renins will act on the adrenal cortex, specifically the glomerulosa. Glomerulosa is to stimulate it to secrete aldosterones. So aldosterones will go to the same mechanism, will increase the reabsorptions of sodium and increase in the reabsorptions of water. Volume expansions will lead to an increase in the blood pressure. But in this case, because there is an overproduction of aldosterone by the adrenal aldosterone producing adrenal tumor, then there is a negative feedback of renins. So a lot of aldosterones available, it's negatively feedback to the body and say, oh, start producing renins. We have a lot of aldosterone already, so that's why aldosterone is decreased. And we will also see that there is also an increase in the potassium secretions, which leads to hypokalemia, and there's an increase in hydrogen secretions, and there's an increase in bicarbonate retentions, which leads to metabolic alkalosis. The diagnosis for Conn's syndrome is confirmed by we see there's an increase in aldosterone and a decrease in renins. That's pretty much it tells you that it's must be Conn's syndrome. If you see on the test, the lab values, if you see that there is a decrease in renins and increase in sodium and increase in bicarbonate, then it's a high suspicion that it could be Conn's syndromes. And we also do a CT scans, and if there's you see that there's a mass on the adrenal cortex with these lab values, then it's highly likely that the patients probably have Conn's syndrome. Okay, so now let's look back here. And we see that there is the adrenal gland right there. Adrenal gland. So we have the capsule right here. The capsule. Okay, the capsule that goes around the adrenal gland is a little layer that wraps around the adrenal gland, and the adrenal gland is divided into the adrenal cortex. Okay, the adrenal medulla right here. The adrenal cortex. So the adrenal medulla right here. So the adrenal cortex is divided into 3 different layers, and we could say that GFR. So the first layer is glomerulosa. Second layer is fasciculata reticularis right here, and so these layers and their functions right here. All right.